But first, how some lesser-known changes to health care might fare given President-elect Trump's vow to repeal the Affordable Care Act. One of those involves so-called super utilizers, high-cost patients who frequently turn to emergency rooms for problems better handled by primary care doctors and social workers. Special correspondent Sarah Varney reports. The story was produced in collaboration with our partner, Kaiser Health News.
Protective gown, rubber gloves, face mask. Dana Gurley is getting dressed for work. She's a social worker, charged not with treating infectious diseases,
hey, sunshine,
but with figuring out why her clients all but live in Houston's hospitals.
What's been going on?
This patient, who asked not to be identified, has chronic massive ulcers, AIDS, and hears voices. And at times spends 3 weeks out of the month at multiple hospitals around Houston. Gurley is part of a promising effort in the U.S. healthcare system.
Hello. Hey, Jesse.
Honing in on so-called super utilizers, patients with complex problems who frequent emergency rooms and cost public and private insurers dearly.
Super utilizers make up just 5% of the U.S. population, but they account for 50% of healthcare spending. As healthcare costs continue to rise, providers are trying to find these patients and get to the root of their problems.
An effort to do just that started in New Jersey's poorest city, Camden. Family physician Dr. Jeffrey Brenner was inspired by how police departments were using crime data to detect hotspots. To find Camden's healthcare hotspots, Brenner dug into ambulance records and ER data to show how high-cost patients were shuttling between city hospitals.
In America, we're medicalizing social problems and we're criminalizing social problems, and we're wasting huge amounts of public resources.
To steer super utilizers away from expensive emergency care, Brenner's team, including social workers LaTanya Oliver and Bill Nice, seek patients out in local neighborhoods.
There's been a few patients that I've had like that.
They work intensively with people like Peter Bowser.
Hey, Pete, what's up, man? How you doing, sir?
All right.
How's everything going?
Bowser was once homeless and went to the ER 28 times in 1 year.
Because I was telling people when I was staying in the shelter, I said, when I get my place, I'm going to maintain it.
But after they helped get a permanent roof over his head, Bowser's trips to the ER all but stopped.
I think you'd prefer to spend your time here than the hospital any day of the week.
This high-touch, data-driven approach has yielded big savings. ER visits for the first group of patients dropped by 40%, cutting monthly hospital bills from $1.2 million to $500,000. The Affordable Care Act has boosted efforts like this around the country by funding so-called accountable care organizations, teams of healthcare professionals who team up to improve care, lower costs, and reap the savings. And it was Brenner's pioneering work in Camden that inspired others, including the program in Houston, a sprawling city desperate to aid its sickest and most isolated patients. While the more than 100 hospitals here typically know their own superutilizers, they had no way of knowing the top users across the entire city. Tackling that problem took unprecedented planning among typically disjointed city and county agencies, hospitals, and nonprofits.
And you know that guy that you helped me get appointments for the other day? Mm-hmm. He apparently had warrants out for his arrest.
Oh, okay.
Now, many of the hospitals here, including the county hospital Ben Taub, pull their data and send it to Kalal Mahata, a former oil industry IT engineer with the Patient Care Intervention Center, who combines it into one database.
And we saw that breakdown by EMS.
Mahata and Dr. David Buck, the group's founder, helped to identify patients at the top of the list, the outliers of the outliers. Some of the data comes from the Houston Fire Department's 911 calls. Then teams are dispatched to parks and neighborhoods to find the patients. Firefighters and paramedics like Thomas Perrell often know these residents from those emergency calls. But this time, their mission is different.
We make appointments, we find specialists, we try to maximize the resources that you have.
The results of these intensive interventions can be stunning. Timmy Williams was dying when Dana Gurley found him.
Has your blood pressure been that high in the past 3 or 4 weeks?
Mm-hmm.
It has been?
Yeah, it bees high. It bees up there.
He was holed up at home and reeling from untreated HIV that had progressed to AIDS. He couldn't take care of his young son and cycled through Houston's hospitals.
When we first met Timmy, he was very hard to engage. We knew that he probably was not taking any of his medication, and He was very skinny.
Gurley arranged for home aide to care for Williams 7 days a week, got his apartment cleaned and the lights turned back on. Now, Williams' HIV is undetectable, and his health and life have been steadied.
This is my Zoloft.
Yeah.
This is for my panic attacks.
Although these efforts involve many staff members, in the 2 years since the Patient Care Intervention Center has been up and running, costs for those in the program have gone down 83%, and hospital visits by 70%.
I really want to get to know them and spend time with them.
But it can be difficult to keep these programs moving. Often, those savings go straight to insurance companies and government payers. And Dr. Buck and Dana Gurley were once banned from a Houston hospital that was afraid of losing money if their high-cost patients stopped showing up.
Nobody wants to take ownership of any of it. People just want ownership of what they have authority over. And that's really the issue.
So this is my COO's office.
Back in Camden, even Dr. Brenner is less optimistic than he once was. His office now overflows with pillows and kitchenware for clients they're trying to place in housing. And he thinks homelessness and entrenched financial interests in healthcare are the biggest barriers.
I think this is going to take a lot longer than I ever imagined. I think we're in a 20-year arc of recalibrating and rethinking what is health and what's healthcare. What's the purpose of our healthcare system? What are we trying to accomplish?
How you doing, Lenina?
But Brenner still believes these intensive efforts are the best way to help patients like Timmy Williams. He's now healthy enough to make his way around the city on his own. He says Gurley did more than rescue him from his darkest days.
I had to put it in my head that no one is going to do it for me. I have to do it for myself. I got to step out and do it myself.
Read this here?
This whole thing?
Yeah.
At home now with his son, his illness no longer gets in the way of being the father he wants to be. But efforts like these could be undercut if President-elect Donald Trump and the Republican Congress follow through on their vow to repeal the Affordable Care Act. And it's unclear what would come next.
Who may stand
For the PBS NewsHour and Kaiser Health News, I'm Sarah Varney in Houston, Texas.
who has clear